we call it fatty liver or visceral fat or organ fat. So it looks like when you wear clothes, you look fine, you look normal. 但是我们去研究血，好像 cholesterol level 或是 blood pressure 或是liver tests, what we will see is we'll see abnormal blood tests for the liver, and we'll see abnormal cholesterol blood tests, or we'll see high blood pressure or 糖尿病, even, you know, pre-diabetes or diabetes issues. 但是这些人他们看起来个子好像是瘦, but when fat goes around the organs, that's where disease begins. And so someone who has fatty liver, for example, 比如说这个 you know, the liver itself is covered in fat. 这个 liver 就 it can no longer clean the blood well. It can no longer process sugar well. So that to diabetes, that lends to problems in blood pressure. It lends to cholesterol problems. So visceral fat, what you described as the skinny fat syndrome, this visceral fat is a disease condition in and of itself. And it can drive diseases that we see on someone's blood tests or on their vital signs when they go to the doctor's office. You know, the doctor will say, well, your blood pressure looks a little bit high. And the doctor looks at the person and says, but they're not that heavy. But what do? They just start them on blood pressure medicine. But the real problem is not that the person is missing blood pressure medicine. The real problem is fat deposition on the liver, on the pancreas, around the stomach. This whole middle section of the body is where all the organs are stored. And so when the body can't process nutrients well, it will just store those nutrients in the middle section of the body.
Yes.
Yeah, it'll just store it there. And over the years, as this goes on, you may feel it, you know, you'll see a little bit more fat deposition on the organs. So that's the difference, is that visually the person looks normal, but internally we see that on a blood test, or we see that on their vital signs when we go into the office. And that is exactly the beauty of using time-restricted eating, is that it will help to remove the fat in the middle of the body.
So your book will tell the people how to use time-restricted eating to energize the person, lose weight, and do all that, right?
Yeah. Now, the interesting thing is, now cleaning out the organs is the first step in what you want to do. 如果你也想减肥，真的应该先从这个中间开始。Because most people, when they do dieting or they increase exercise or they try to reduce calories or change what they're eating, they're not targeting the organs. They're not targeting organ fat. So you'll see dieting fat come off much quicker. You know, someone says, oh, I lost 6 pounds this week, or I lost 4 pounds 2 weeks later. And you'll see this really aggressive weight loss. But actually, it's not removing weight from the organs. So you'll see their arms get skinnier, their face and neck get skinnier. But this center part, they'll say, oh, you know, it's still around my stomach. It's sticking there. Why doesn't it come off? Because the body doesn't want to lose weight that way. So the 中间 area will be the last place weight comes off if you're doing diets or just exercise increase or just changing composition of what you're eating. Only time-restricted eating, regular circadian eating and fasting interval, only that will target that organ fat